Do you frequently feel like your heart pains sometimes? Or maybe you've had a fever that just won't go away, along with body aches and extreme tiredness. You might think it's just the flu, but in some regions of West Africa, these common symptoms could be a sign of something more serious, Lassa fever. Imagine your neighbor suddenly gets very sick after cleaning their home and finds rodent droppings in the grain they've been eating. That could be how Lassa fever starts. It's a disease that often flies under the radar because its early signs look like other common illnesses. But if not caught early, it can become dangerous. Let's walk through what Lassa fever really is and why it matters, especially if you live in or travel to affected areas. So, what actually causes Lassa fever? Think about a tiny rodent, specifically the natal multimammate mouse. This little creature is common in parts of West Africa and carries a virus in its blood and urine. Now, imagine storing your rice or corn in a sack on the floor, and a mouse peeks in, leaves droppings, or even dies in it. If you later cook and eat that food without knowing, you might swallow the virus. That's the main cause. The Lassa virus spreads to humans when we come into contact with the droppings, urine, or saliva of infected rats, especially through contaminated food or household items. It can also spread from person to person through direct contact with blood, body fluids, or even contaminated medical equipment. So it's not like a cold that spreads through the air. It's more about touch and contaminated things. How do you know if it's Lassa fever and not just a bad flu? Early symptoms include fever, headache, muscle pain, and feeling extremely tired. Very common signs. But here's the clue. If someone has these symptoms and recent exposure to rodents, or lives in an area with Lassa cases, that raises a red flag. Some people go on to develop more severe problems, like vomiting, diarrhea, chest or belly pain, or even bleeding from the gums, nose, or in vomit. Your heart might feel like it's racing. This can happen due to the body struggling. In rare but serious cases, people can go into shock or have trouble breathing. But remember, not everyone gets severely sick. In fact, about 80% of people have mild symptoms or none at all. The tricky part is that it looks like so many other diseases. That's why doctors need to ask, have you cleaned a dusty room where rats might live lately? Or have you cared for someone who was very sick with a fever? A nurse in Sierra Leone sees a patient with high fever, unusual weakness, and slight bleeding. They remember that Lassa has been reported nearby. So what next? First, the doctor collects a blood sample, not right away without care, though. They wear gloves and masks to avoid catching it. The blood is sent to a special lab to test for the Lassa virus. This test looks for the virus itself or the body's antibodies fighting it. But results can take time. While waiting, treatment is often started early if Lassa is suspected, especially with a drug called ribavirin. Think of ribavirin like a shield that helps stop the virus from multiplying. It works best if given in the first few days. The patient also needs fluids, rest, and care for symptoms, like treating dehydration. But in many rural areas, labs and medicines are hard to reach. That's why speed and awareness are crucial. The message: if you're in a risky area and feel very sick after possible rodent contact, seek care fast. Can you really stop Lassa fever before it starts? Yes, and it starts at home. Imagine you're packing away your grain for the month. Instead of leaving it in an open sack on the floor, you transfer it into a sealed metal container. That simple step can block rodents. This is called rodent-proof storage. Other smart steps: keep your kitchen clean, dispose of garbage far from the house, block holes in walls where mice can enter, and never sweep dry floors where dust with dried droppings can fly into the air. Instead, dampen it first. If you're caring for someone sick, always wear gloves and wash hands thoroughly. In hospitals, health workers use special protection to avoid exposure. Communities can also run education campaigns, like a local drama group performing a short play showing how cleaning food properly can save lives. Prevention isn't magic. It's daily habits that make a big difference. Good news scientists are working harder than ever. Imagine a future where a simple vaccine stops Lassa, just like measles shots do. Researchers are testing prototypes. The first possible Lassa vaccine entered human trials recently. That's a big step. Also, new rapid test kits are being developed like a pregnancy test, but for Lassa. It could give results in minutes, right, in a village clinic. Another cool advance is using digital maps and phone reports to track where cases pop up, helping health teams respond faster. Scientists are also studying the rat populations to understand when and where outbreaks are more likely. All of this means there's real hope. While we don't have a vaccine, yet each year brings us closer. And in the meantime, knowledge like what you're learning now can be the best